How does functional back training treat the back? Sore back has three main reasons, and none of them is the structural problems. Number one reason is control problems. So the muscles and fascia don't know how to control the correct positions. Second problem is stiffness. Muscles and fascia at certain points are just too stiff and they prevent healthy movement. And the third one is that some muscles are just too weak. And all these three problems work together and in some point against you. So on the picture on the left, this person has too much arch in the lower back and the hips are turned forward, what we call anterior pelvic tilt. Now, why this is happening? There are several reasons, and one is that there is no control, or there is some kind of problems in the control in the stomach muscles, mainly in the deep muscles, the abdominis transversus. And also there's probably stiff hip flexors, so they are pulling the hips forward. There are probably weak glutes, or there is let's say a firing problem in the glutes, so the glutes aren't working correctly. And when the lower back is arched like this, the back muscles have to work really hard trying to keep the right position, so they are usually stiff. And stiff back muscles also prevent the healthy rotational movement. And now if you look at the picture on the right, the position of the pelvis and the spine is much more vertical, so it's easier to maintain this kind of position. The back muscles don't have to overwork. The glutes are trained properly, and the hips are not too tight, so they are not pulling the hips forward. And the stomach muscles are working, giving the spine a support. So all this is actually functional. How the muscles work and how the fascia, let's say it works also. It's not dead tissue, not at all. Now you may ask, okay, but what about if I have bulging disc or I have degeneration? These are, of course, sometimes a problem, but you have to know that actually most of the people over 40 years old do have some bulges and some degeneration. It's just normal getting old. Just like your skin gets old, your discs get old. But it doesn't need to cause symptoms, cause pains. So even if there are some bulges, some degeneration, if the spine is positioned correctly, there is room for these getting old problems, so they are normal. And if there is no support, then they become bigger problems and the bulges become so big that they can press on the nerves. And that's a problem that needs to be dealt, of course. But even if somebody goes through surgery in this kind of a really bad bulge, they still need to correct these functional movements. So when we keep our body functional, we train our control, we train our ability to move, the fascia is movable, and we have enough strength in the muscles, and the muscles are firing. We can have the healthy back. So click on the link below and look at this training and start trying them, and let's build you a healthy back.